we do have health disparities in the United States, and there are underserved communities that can benefit from this kind of model where you actually reach out to the community than waiting for the community to come to you or to the healthcare system.
This is Zach with the American Journal of Healthcare Strategy. Welcome to the Clinicians and Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. Today, I am joined by a very esteemed guest, Dr. Misker Teka. Dr. Teka, why don't you take a second to introduce yourself and just tell us a little bit about your experience?
Yeah, thank you, Zach. I really appreciate the opportunity to be on this podcast. So, as you mentioned, my name is Misker Teka. I'm a medical professional by training. I'm a general practitioner. I graduated in 2020 from St. Paul's Hospital, Milne Medical College, which is based in Ethiopia. I also hold a master's in public health from Johns Hopkins. I graduated this May in 2024. So my interest is more of health equity, healthcare leadership, and community-based health. I think one of the great works I've done, I would say, is co-founding an impact organization called Give Society Ethiopia, which is based in Ethiopia, that provides free healthcare for underserved population using volunteers. We have monthly free medical campaigns where we bring in doctors to give this comprehensive medical services. Besides that, I use social media and different platforms to share professional development, especially focusing on medical professionals from low and middle income countries. Starting from my own country, Ethiopia, I have a YouTube channel. I write different things on LinkedIn. I love to share my experiences. I would say I'm a very community engaged professional. Besides that, I work with Johns Hopkins on different projects. One of them is the Alumni Association for the Ethiopian students, where we mentor current students and also provide different networking opportunities and mentorship opportunities for alumni, and just to connect with each other. So that's me in just bit words.
Yeah. Yeah, well, and
Yeah.
I'm thrilled to have you on today, Dr. Teka, and just to hear a little bit more about your experience and just to hear some unique insights that someone who has made such an impact on the international medical community, serving in some very cool ways like you have. And so I'm curious. You've shared a little bit about your experience thus far. And you have a lot of experience in a lot of different areas. What has been one of the most impactful experiences that has developed your approach to leadership in general, and then kind of specifically within the medical field?
Yeah. I think for me, working within Give Society Ethiopia, you would hear me mentioning a lot about Give because that's one of my formative leadership experiences. I co-founded Give Society Ethiopia like 3 months after graduating from medical school when I was 25, and I was really exposed to leadership during that time. And because our organization is volunteer-based organization, and because we serve a lot of medical services, I had the opportunity to work with a lot of volunteer medical doctors, and all of our team members are volunteers. So having to work with volunteers, I think leadership becomes a bit more challenging and makes you work twice as hard, I think. So for me, what made volunteerism or just the concept a bit more challenging was you don't incentivize someone based on money or fame or something like that, but it's you actually connect to the person, or you lead based on the cause, or that's what connects you. So keeping them inspired, keeping them going, and leading with really intentionality is what I think learned during that experience. And also, I think working with a very low resource setting, I think it has made me a leader who kind of becomes more innovative and solution oriented. Our organization was mostly, or is still mostly, in kind donation focused. So having always to find partnerships and collaborations and finding ways to cut back on our costs, I think that really made me a leader that thinks about outside of the box and really focused on collaboration and partnership. Yeah, I think that was a very formative experience for me and great experience when it comes to leadership.
Yeah, well, and just I'm imagining the impact that an organization like Give can have, not just through the volunteer hours and the things that those volunteers accomplish, but I mean, starting with the leadership, making and promoting a culture of belief within its volunteers. That starts at the top and trickles down and allows your impact and what you've done to reach far and wide. And I think that is one of the coolest things, just like learning more about you in the previous conversations that we've had, is just to hear how one person can do a lot of really good, and that's just by inspiring others around them. And so that's
Yeah,
fantastic. And so
yeah,
something else I'm curious about, and you mentioned this in just telling us a little bit about your experience. You are trained as a medical doctor at in from Ethiopia. Your training and your internship and all of your clinical training is from when you were in Ethiopia. I'm curious now, having transitioned from being within the Ethiopian medical system to now being in America, in the American medical system. What are some unique skills or insights that you gained in that international training that helped you excel and transition well in your current leadership role here?
yeah. I was actually very lucky to come to United States before my master's program in 2022 for a leadership training. It's called Mandela Washington Fellowship. It's for young African leaders, and it's US state sponsored. So I stayed in Rutgers University for 6 weeks, getting trained on leadership, the American style of professionalism, and so on. So I was really lucky to have that training on how to interact with different team members, because we had fellows or leaders from all over Africa, and then we had mentors from different US based organizations. We had the opportunity to listen to very esteemed senators, leaders, nonprofit, private sector leaders, and talk about their experiences working in the States and working in global health and so on. So I think that exposure for me kind of helped me understand how a completely different country works, or like have different values. But also, I think when I was a student in Hopkins, I had different part-time jobs where I worked with Center for Health Disparities. I worked with a professional development center within the undergraduate program. So I had different interactions with different professionals. So it was easy for me to kind of understand, okay, this is how things are done. Cool. So for me, I think to conclude it, really just analyzing and seeing and then learning and mimicking that helped me kind of transition from the working style that I was used to in Ethiopia and then coming to the American way of doing things.
Yeah. And going off of that a little bit, something else I'm curious about is, you just shared a little bit more as well. You have extensive experience within the medical field, both in Ethiopia and in America. What are some things about the Ethiopian medical system that you believe could, if implemented, improve the healthcare system that we have here in the United States?
Yeah. It would be very hard to compare the Ethiopian healthcare system and the US healthcare system, obviously, because the Ethiopian healthcare system is very resource restrained, cost restrained, and the US healthcare system is much better because it's one of the most developed and powerful countries. So it might be hard, but there's always something that we can learn from others' way of doing things. So I would say two things. One is Ethiopian healthcare system is very community based. When it comes to health service deliveries. For example, one thing I can mention to you is we have something called a health extension workers program, where different health extensions go to house to promote health education, to give them preventive services, and to kind of even give them curative services to actually to more of like rural areas and underserved communities that is very hard for healthcare services to get delivered to. So I think the American system can learn from this, and because we do have health disparities in the United States, and there are underserved communities that can benefit from this kind of model where you actually reach out to the community than waiting for the community to come to you or to the healthcare system. So I would say this is one of the best ways the American healthcare system can learn. Second, I would say even though Ethiopia has a lot of resource constraints, most of the healthcare delivery is cost effective or low cost. That means more population can get services as they need it. I would say the American healthcare system is a bit business focused, making it for those with low resources to kind of make it hard to get the services they need, and maybe die from or like have like complicated scenarios from cases or diseases that can potentially be prevented. So I think these two ways are that came to my mind when it comes to the American healthcare system, kind of like having one insight into the Ethiopian healthcare system. Yeah.
Um, Dr. Tika, something else that I want to talk about, and I'm curious to hear your perspective on this, is within healthcare. Um, Anywhere you're serving within healthcare, you are working with different individuals with different skill sets, and it requires those different individuals with different skill sets to work together and collaborate and around a common goal, which is taking care of patients.
Mhm.
Um, I'm curious if you have any particular insights on how to bridge cultural and professional gaps within these healthcare teams that ensure or better ensure collaboration and inclusivity as well. Do you have any insights into that?
Yeah, that's a great question. And I think you've kind of answered it when you were asking the question. I think the most important thing is being vision focused, or like what brought that team together is really wanting to, cure patients or have better health policies or have better healthcare services, right? So kind of putting your mind really to that and really focusing on that as a first step. And then the second thing is, I think, understanding that our cultural beliefs, where we come from, our perspective kind of affect how we show up in a team, how we deliver our work, or how we interact with our patients and so on. And especially healthcare being very person focused, communication focused, I think it's very important to understand that. So I think whenever we interact with our team, I think we should always have at the back of our mind that this person might be doing this because of how they see the world or how they're brought up or how their culture is. And trying to understand that is very important first before judging them or, just deeming them, I can't work with this person or so on. So first, really understanding is very important for me. And that's how I think that I was able to work with different teams from people from all over the world. And then again, the second thing is I think also valuing a person's perspective or differences will make a difference, in my opinion. Rather than being comfortable in our own way of doing things, I think maybe we should be like, okay, let's give this a try. What is this person saying? What can I learn from this working style or this communication style or so on? I think that valuing that person's opinion for me has worked in my career, I guess.
Well, I love the words that you used, valuing, understanding, growing in appreciation, and going off of what you just said. So we just you shared some great insights on how to value other members within the healthcare team that you're serving with. I'm curious now to get your perspective on how healthcare leaders can grow in their understanding and appreciation of the culture and the community and the patient population that they serve. I think that you have some unique insights into this, having served a variety of patient populations in a variety of cultures. How have you grown in your understanding and appreciation of the different cultures? Because really, to prioritize the patient, you need to appreciate and understand the culture and the community. So if you don't mind sharing some of the insights that you have and you've done specifically, and then if you have anything that other healthcare leaders can do and implement to better grow in their appreciation and understanding of the culture.
Yeah. I think I can answer this from 2 points, from my clinical days and then from my more of healthcare leadership days. From my clinical days, I'm not trying to brag, but I felt like my patients really loved me. I think that was because I listened to them. I really gave them time. It was hard. I had a lot of patients, but I love to listen to them, make them feel heard. Because most of the time, we don't really need to do so much to understand or to get to the diagnosis, because the patient will tell you the patient's culture, the patient uh, symptoms. Just listening to the patient has a lot of value than sometimes the other diagnostic tools that we use. So for me to understand the culture, to appreciate where they're coming from, really listening, because sometimes we rush to make decisions, we rush to prescribe medications, or we rush to make policy change. But before that, let's, I think, listen to what the person or the community is saying. Second, from my healthcare leadership days, again, going to Give, I talk about Give a lot because that's where I have done a lot of work. And I think one of the proudest moments of my career is just serving 40,000 plus patients, just using really small resources and using volunteers. So I think what we did with Give is also, again, the same thing, listening to them. So before we do campaigns and before we bring in volunteers and our resources and before we try to treat them, we actually go like a week or 2 weeks ahead of time before the campaign and talk with community leaders, with youth leaders, with community, just people within the community that really understand what the community needs. We don't just come and say, okay, today we're just gonna do breast cancer screening, or we don't generally just come and say, today we're just going to give you routine medications. We actually sit down and listen to them. What is your problem? What are some of the services that is very hard for you to get? That way we actually know what is impactful, and also we ask them, what are some of the beliefs that you have? What is the best way for us to give you health education? Sometimes for us to just come and talk about hypertension might not be the best. Sometimes we need to bring an actual patient who went through a hypertension crisis or so on, and to talk about their experiences. So really listening, I think for me, is something that I really stress on, both in the clinical setting and in the public health setting.
Yeah. Well, and
Yeah.
we we've talked about just here today, as well as a number of other times throughout some of these podcast episodes that we've produced, but just the importance of listening, like you just said, and understanding what the patients and the communities need, because the the healthcare systems exist for the patient. If there's no patients, there's no healthcare system.
Mhm.
And to to not listen to your patients is to you're not serving your patients, not nearly as well as you could be. And in a world and in a healthcare system that constantly needs to be evaluating, constantly needs to be improving, one of the areas that I think is most critical, and you nail this perfectly, is just to constantly evaluating, hey, how are we listening? How are we improving in our listening? How are we improving in our understanding? And that's it's sad how it's both encouraging and sad how simple of a solution that is. Encouraging in the sense that, yeah, all it does is just asking, going to those community leaders and asking, going to the people and asking. But it's sad in the sense of how uh rare that can happen, and how that is often a step that's missed. And so I really appreciate your insights. I think that's phenomenal. That And you answered my next question just a little bit, but I'm going to ask it anyway, and to hear if you have anything else that you'd like to mention with it. Just how can healthcare leaders better advocate for equitable care, particularly for those underserved or immigrant populations who may face cultural and language barriers? We've talked a little bit about the just disparities in health, and I'm curious, how can leaders, we we've mentioned before that the leaders, it things the culture that the leadership sets trickles down. How can leaders better advocate for this equitable care for these patient populations?
Yeah. I think the first step would be for healthcare leaders to understand that it is a it is a privilege for them to advocate on behalf of this population, because this population cannot advocate most of the time for themselves. They're very vulnerable. They don't have resources, so they're kind of forgotten and neglected. So I think understanding that you are in a position of power and privilege to support those communities is very important. And knowing that you can actually do something is very important. It's not other people's job. It is our job as healthcare leaders to do something. I think we should not wait for anyone else. So that's the first step. I think second, again, coming back to listening and understanding what is their problem, because they have a unique set of problems from other communities, right? Because of resources, because of their immigration status, because of gender, sexuality, and so on. Because of so many reasons, they have different problems and challenges. So really getting to them and understanding what is the problem, and usually they'll give you the solution. Funny enough, yes, I'm not saying you don't need to do research or you don't need to have elaborate plans to understand what the problem is, but most of the time, I think just listening to them will give you a lot of insight on how to solve their problem and what their pressing issues are. So I think the two things, as I said, is understanding that we are we have the privilege to serve them, and then to listen to them and to really get solutions and challenge to understand them well. I think those would be my advice from my own experiences.
Well, and I again, we've talked about it with the last question, this question as well, just the importance of listening and responding to the needs that the patient has, and what they have, and communicate, and just the importance that a healthcare system and the benefit and the value that a healthcare system can have by doing that effectively within for their patients and the communities that they serve. And so, um, Well, Dr. Teka, we really appreciate you coming on the show and sharing your insights. I'm thrilled just to have gotten the opportunity to meet with you and to hear and to listen to as you've shared just all the different insights that you've had, and I'm grateful for that.
Thank you so much. It was a pleasure to talk to you and to share my experiences. It has been an honor. Thank you so much. Yeah, I appreciate the opportunity.